Hello everyone. You all did such a wonderful job highlighting the trends that I wanted to compile all of the information that you put together and give it back to you. That way you can see all of the reported trends from a variety of different fields. Now, I'm not going to say that this list is all inclusive. 10 years is an incredible timeline. That's an eternity in terms of technology. I think, really, I think a lot of these trends probably encompass the next 5 years. But some of you did put out some pretty deep thinking trends, and I think some of those things may potentially come to fruition. It'll be interesting to see how, if I pull this list back out in 2026, what actually occurred, what's still currently occurring, and what has not yet occurred. I think it would be a fun little study to be able to evaluate. So I've organized the trends so you're not going to know who they come from or who reported what, but I wanted to at least semi-categorically organize them. So I put them into categories of informatics, dose utilization, equipment protocols, and then basically a lumped together category of other. So I think that'll help kind of ease some of these transitions. I'm not going to spend an abundance of time kind of talking about them, but these should give you some ideas for you to be able to further investigate if there's something reported that intrigues you. So in terms of informatics, and that's the theme of what we do. We've been talking about technology a lot, and there's nothing more powerful than looking at essentially processing algorithms and how that ties back to information. So reconstruction algorithms, I think, are really important. Scatter correction, field flatness, all are very important algorithms. But the more algorithms are utilized, the better our techniques can be. So we can essentially lower our energy dependence. And I look at that, I use the phrase energy dependence because it may not just be ionizing radiation. It could be energy utilization in sonography. It could be utilization in MRI as well. So I think, algorithms and processing, I think, is really important. CAD, CAD, computer-aided detection, I think is absolutely paramount. I can kind of foresee this becoming eventually a first reader. Currently, it's considered to be a second reader. It's utilized primarily in mammography, but also for low-dose lung screenings as well. But I imagine that in time, these processes are going to be eventually, I'm not going to say replace a radiologist. I think the radiologist will probably always have, final word. But preliminary reporting, I don't think is too far out of line for what the equipment may be capable of doing. Image fusion technologies, I think, are important. When you look at what goes on in radiation therapy, you do have the ability in treatment planning to be able to fuse data sets together. So you may be able to fuse the CT planning scan on top of the MRI scan, and then also import then the PET, and then essentially, you have all of this data that's commingled, and it really allows you to really see the processes that are going on. So that's for treatment planning, though. In terms of what could go on utilizing and combining that information for regular diagnosis of the patients, I think is going to have some impact going forward. PACS and EMR integration, I think, is something that should happen. Essentially that the person's information should travel with that person. It should always be available. That way we're not duplicating orders, exposing patients to unnecessary radiation exposure, etc. Something interesting that one of you reported was texture mapping software for detailed tissue analysis, essentially. So I think that softwares and applications that are out there are going to be able to give us lots of information. Could that potentially one day replace invasive-based investigations in general biopsies? Perhaps. It'll be interesting to see if biopsies are not necessary in time because the information based on, rendering based on algorithms and software already reports basically cellular components and makeups. Could that happen? Absolutely. Brace yourselves. Xbox Connect. This technology was used in preliminary fashion to basically analyze the tissue thickness for selecting optimal factors in projection radiography. So basically would allow you to be able to select optimal KVP and mass without any form of measuring. So it basically had, intertwines that old school fashion of calipers for measuring for optimal technique, but it utilizes it, of course, in a extremely precise fashion. So interesting technology to be aware of. Wearable patient identification media is pretty interesting. Basically, it's the patient wears their electronic health record with them. It travels with them, so all of that information would always be known. Would that be, implanted in your brain or in your arm? That would be interesting. And could it happen? We're starting to talk very, in my opinion, very sci-fi. But you look at how technology is going, and a lot of these things are, at least possible. Teleradiology and its need was reported by several of you, and one interesting statistic that came out was that accuracy in reporting was better for teleradiologists than radiologists that worked on site. So that's I think a very interesting finding. Yes, that does remotely tie in with cloud storage and kind of that PACS information as well. Accessibility, I think all of those areas are very, very key. Preliminary diagnosis, scanning, so basically you have a CT scan and out pops a preliminary diagnosis. This basically utilizes that CAD type of technology to at least produce some type of prelim. I would consider that preliminary to be an example of that first reader, which I was kind of mentioning which, the radiologist, as it stands now, is the first reader. But that may in time change based on technological innovation that could occur in our field. So I think a really interesting concept there. Dose utilization and management, I think, is absolutely imperative to be able to control. For that reason, I'd mentioned that I think sonography modalities and MRI modalities are going to become more and more important as we go forward. To kind of get away from that ionizing radiation. But if we can just control the utilization of ionizing radiation, it has such an important factor in what we do. And the emphasis is there with smart dose or dose-wise in some of those dose-based standards that are out there for tracking and reporting purposes. We have to hold ourselves accountable. We have to establish metrics. We have to make sure that we're measuring. And we have to make sure really what we're doing is effective. And I think justification and optimization, I think, are absolutely key. In in time, could the justification of that procedure be eventually linked to reimbursement? I don't think we're too far away from that. I think 5 years are, it would probably be a maximum in terms of justification and reimbursement. We're almost there in terms of requiring the use of ACR appropriateness criteria. I'm not going to say utilization because it's not what the current recommendation is for its 2017, but it's basically they have to at least consider the guidelines. They don't have to adhere to them, but they have to at least consider it. And this is ordering physicians is what I'm talking about. Dose efficiency improvements in equipment, I think, is paramount, especially when we're talking about CT. Obviously, CT has gone night and day in terms of utilization factors or efficiency factors of that dose, but I anticipate it to continue to evolve and get better and better. That, of course, is fully technology reliant in terms of our detectors and their subsequent efficiency for converting that energy into useful information. Other points, so kind of getting into some equipment, I'll just touch on some of these things. MRI field strengths are certainly are increasing. 1.5 to 3T. A lot of research technologies are exceeding that 3T, and with that becomes increased screening precautions that have to take place. It'll be interesting to see how those screening precautions change. It'll be interesting to see what the Tesla strength of those magnetics of the MRI machines becomes the standard practice. Intraoperative MRI, the potential of that was quite interesting. So if you don't know much about the use of MRI in the operating room, I would encourage you to look up that. I think it's pretty interesting, something definitely interesting to consider. Multimodality utilization for breast evaluation. There's actually a trending practice to avoid the phrasing mammography, because breast imaging is becoming more than mammography. So it's actually going to be called breast imaging. So in terms of a trend, you can kind of train yourself to just call it breast imaging because of the utilization of alternate modalities. So sonography, MRI, there's nuclear medicine applications for breast imaging as well. Cardiac procedures, I think, are continuing to evolve. This is definitely not something that's not occurring now, but something that could continue to evolve going forward and become more and more precise for patients. Definitely, I think imaging plays the role in eliminating all forms of investigative or exploratory-based surgeries. So angiography is another great application, CT-based angiography, CTAs. MR and ultrasound point of care use. So this is basically utilizing these tools in emergency situations. MRI is kind of the interesting one in this because of the screening-based precautions that have to take place before we can get those procedures. Targeted nuclear medicine treatments, I think, are important. I very much view the future of nuclear medicine as being one where it's going to take, basically, I think it's going to transition into a treatment-based area. So it really is really important in terms of function as we speak now, but in terms of treatment, I really foresee that continuing to evolve. PET-MR is obviously available, but not widely utilized at this point. Utilization may increase. Elastography through sonography, low-dose lung cancer screening protocols and practices may continue to evolve as well. So a lot of important trends there in terms of equipment, protocols, applications of the use of our equipment as well. Some points in terms of radiation therapy. Radiation therapy is a beast in and of itself. It has evolved considerably over the last 10 years. 10 years from now, I imagine it's going to be very, very different. Stereotactic radiosurgeries, radiotherapies, basically for increasing targets and target delineation, tumor control, making sure that healthy tissue is spared, I think will continue to evolve. There's a lot of use for protons and neutron-based applications in radiation therapy as well. Combined CT and MR scanners were mentioned by a few of you, basically to maximize the information that's derived from each of those. CT is of course good for that bony detail, where MRI is awesome for that soft tissue based information. So combining that, does that make the best possible tool? It makes a really awesome tool. Obviously there would be unique precautions, but unique information would be the result. Functional neuroimaging, there's functional MRI studies do occur right now, but in terms of really understanding, the brain and the pathways, neural connections, I think imaging is definitely going to play a role in understanding why people do what they do, and that's I think not too far down the road. Let's see. Image quality, diagnostic accuracy, I think is definitely important. Speed considerations are important. Proton imaging was reported by a few of you in replacement of X-rays. So we're not talking about X-ray photons, but we're talking about protons, so positive particles. So that imaging technology may soon advance and become in the workplace as well. Other trends in terms of policy now, modality-specific education requirements. I think that this is definitely on the near horizon, 2020. 4 years down the road, I don't foresee these being too far away. Reimbursements based on the technologist qualifications may be a thing. I think Medicare, Medicaid plays a big role in how fields operates, and I definitely can see the government needs to, population is aging, less money is becoming available. How do we control that? How do we make sure that patients are getting what they're actually paying for, and how can we increase the level of quality that's being delivered to our patients? Bachelor's degree standards, could it become a point where the associate degree is phased out and the bachelor's degree becomes the standard within our field? Perhaps. May that be within the next 10 years? Perhaps. It's something to that's definitely could be on the horizon. It's definitely going on kind of as we speak in the nursing realm, depending on your location. But here throughout the state of Ohio, the BSN is becoming a standard of practice. So that could be something to look out for in our field as well. Cost control, utilization control, I think are important. Other countries have better prevention models as well than what we have here in the United States. So could we glean a lot of helpful information from other countries? Absolutely. We have a focus essentially on what I call sick care. So somebody gets sick, we treat that information. We do not have a large percentage of focus on prevention. There are talks that's going to change. There are some changes that are currently occurring, but not nearly enough in comparison to the health-based outcomes that are happening in other countries. Clinical decision tools. This really goes and ties back to ACRAC, that American College of Radiology appropriateness criteria, and making sure that you are selecting the appropriate imaging exam for those for the patient's conditions. Look out for those to evolve. As I mentioned, 2017, you at least have to consult some type of clinical decision-making tool. So in terms of tying that to reimbursement, that's really the driving force. Accreditation factors, I think, are going to continue to be looked at favorably in terms of providing those reimbursements. They already are linked, but I anticipate that dependency factor will continue to be linked. And then finally, basically proving the worth of medical imaging is something to consider. So medical imaging is a support tool. It's a support tool for other areas of medicine, essentially. So medical imaging has to prove its worth as the reimbursement model is changing from that fee-for-service model where, you know, the radiologist got their reading fee, the imaging department got their X-ray fee or their CT fee back, to basically that patient diagnosis. So you get the lump sum of change, and it needs to be distributed to its given components. That has a lot of ramifications on how medical imaging is practiced. If we're not getting those reimbursements back effectively, then, you know, staffing levels are going to be impacted as a result. So keep that in mind. You know, start to think about making sure that you're promoting the worth of medical imaging within the workplace. It's obviously one of the most important tools, if not the most important tool in medicine. Outside of perhaps lab. I think lab has a lot of value as well. I think the two go hand in hand. Lab and medical imaging are the diagnostic tools that are available for the patient. Outside of that, it's basically based on clinical assessment, you know, based on how the patient is presenting. So that subjective and objective data, which isn't necessarily the most reliable in terms of, you know, finding out what's really going on with those patients. So lab and medical imaging, I think, are superior to other areas. Other trends, so contrast evolution and contrast protocols were mentioned by a few of you. Definitely, I think that contrasts are going to continue to evolve, just like drugs and medications. You know, that evolution will continue to take place. 3D printing is something that, if it doesn't happen in-house, I believe it'll be something that will be outsourced. Definitely a lot of potential there to make sure that surgical approaches are appropriate. So basically taking those 3D reconstructions from CT and MRI based information, printing them out, and then basically having a full awareness of what's going on with that patient at any given point within that patient. Basically increases in obesity within this country have caused medical imaging to evolve as well. Wider tables and boards definitely are considerations. Video collaboration was something that was mentioned in terms of consultations. You know, telemedicine. You know, would you potentially always see your PCP in front of you to, you know, give you that information, or would you be actually consulting to a screen? You know, it'll be interesting to see, you know, how long we actually have a physical person in front of us in terms of our primary care physician with the evolution of telemedicine. Disease-specific molecular imaging tracers. So basically, for a given disease, could you potentially tag a not necessarily even a radioisotope. Maybe it's tagging specific pharmaceuticals to really to diagnose that information. Does that tie back into nuclear medicine philosophies and ideas? Absolutely. It'll be interesting again to kind of see how those areas evolve. So this is 20 minutes. I'm going to call it good. I got through essentially the essence of the majority of the points that were conveyed within those trending papers. Continue to watch the trends going forward. Continue to stay abreast and aware to what's going on in your specific fields or those fields that you want to merge into. Staying on top of your game certainly is going to prepare yourself for additional opportunities going forward, and I really, really look forward to seeing how your careers evolve. Thanks for watching. Have a good day.